Hello and welcome to the top highlights of Budget 2025 and of course the big hits and the big miss really from this budget. We're going to focus exclusively on the healthcare sector. We have with us for a very special and exclusive interaction Dr. Naresh Trehan, Chairman of Medanta Hospitals. Thank you for your time. This budget, we heard the Finance Minister focus on the healthcare sector at large. Of course, talk about more students, more employment generation, from medical tourism to, of course, the role of AI as well. So we'll discuss all of this with Dr. Naresh Trehan. I'd like to begin by asking you, of course, more students, more employment generation indicated this budget for the medical sector.
Yes, there's a very positive news about creating 10,000 more seats for medical education, which is a big step forward. It's part of that 75,000 that was announced in July, but this is a significant step that is coming this year, 10 years. That's what we need for sure. The second thing is that the centers of excellence that were announced, 5 centers to be established for upskilling of and creating employment opportunities. Healthcare is a very large employer of human capital because for every bed that we create to treat patients, you need a minimum of 4, but up to 7 to 8 personnel per bed. So there is a huge upside when healthcare is sorely needed. 1 million more beds need to be created in the next 3 to 5 years, and that means 7 million more people can get jobs in the coming years from healthcare sector. So yes, these were the two very important things. And then, of course, there were other things that were related to the relief that cancer patients are getting. Now, cancer spreading like wildfire. It is actually a big challenge for the whole world, not only India. And what are the two significant things that were introduced by the finance minister? One was the duty exemption on cancer drugs when they are imported. That was a big cost to the patient. So with this happening, this saving will be passed on to the patient and they will get a big relief. So that's a very good move forward. Equal to that, or even more important, is the fact that she announced that there will be one cancer daycare center per district in the whole country, and 200 of them will be operationalized this year. That gives huge relief to cancer patients because for them to go long distance to get their chemotherapy, which may be as frequently as once a week, they would have had to travel in a sick condition to long distance. This will give them big relief. So these are two big things that happened there.
Absolutely, like you said, cancer patients, patients going through serious illnesses at large, as well as those who are senior citizens, found a key mention in the finance minister's address.
Right.
So your thoughts on how all of this can be implemented? Of course, these announcements have been made, but we need to implement this at a far, far quicker pace for us, our vision towards Viksit Bharat 2047.
So this is an opportunity actually. There is a PPP model available where the private healthcare providers, which is about 60% of the entire country, they can actually partner with the government to operationalize or create, depending on how the government looks at it. But these PPP models are available, are very successful. We have one in Patna with a huge hospital that we built in collaboration with the Bihar government, and it's working very nicely. So I think that opportunity needs to be exploited more and more because like you said, it can be brought to creation very quickly, operationalized very quickly. So that depends on how the government looks at it.
Right. I'd also like to ask you that you look in the healthcare sector in particular, that divide between rural India and urban India seems to be significant. We sort of see patients go through very, very different experiences altogether. So how do you think that can be addressed as well?
So, the infrastructure has to be created. And what we talked about, you need human capital also. If you don't have the doctors, you can't make a building. Building won't do anything. So that's why this is all in tandem. And that's why I was happy to say that the government's announcement today has been quite favorable as far as creation of more doctors is concerned, the skill centers, and more importantly, the cancer thing is the other. The thing that is even supplementing all this or complementing all this is medical tourism. That India has a huge potential. Why? Because we are able to provide the highest end of care to the patients at a reasonable cost. So if we actually exploit that opportunity for India, we can at least double, triple our revenue from inward travel for patients from other countries for medical treatments. So I think we have a good spectrum, allopathic treatments, traditional medicine, all that will contribute. So I think overall it's looking forward, step towards Viksit Bharat in 47. And if everything else has been very positive, one more positive thing was the establishment of or allocating 500 crores for centers of excellence for AI.
Absolutely.
Healthcare is a major user of AI, not
Right.
only from now, for many, many years. And we are actually creating algorithms to be able to predict how people will live, how healthy they will be, and what are the dangers that they have in the coming lives. In other words, creating a health horoscope for an individual.
The health
And AI,
horoscope for an individual. Yes, very, very crucial there. We did hear the finance minister talk about medical tourism and address AI at large, artificial intelligence, integral really to the path forward. But how can the healthcare sector adopt this, quicker and set an example for the rest of the world? We hear examples, but how can India sort of lead the way?
I have a belief that the Indian brain is better than anybody in the world as compared to countries are concerned. The second thing is very important is that we do not, so far, we are lacking the ecosystem to move forward quickly. So that collaborative effort that is required to move the needle forward at a higher speed was so far missing, but that's one thing that is coming into play as people are realizing that nobody can do anything or create high technology on their own. It is always a multiple partner effort, which will, if you want to go to a spaceship, you can't make all the components. You have an idea, you are the creator, but you need that whole system to support you. In India, we have not been able to do that yet, but it's happening. The government is looking at more and more areas to develop so that overall we reach our goal by 47. I think today was one small step towards that.
One small step towards that, and a crucial one at that. I'd like to end by asking you, what to your mind then needs more improvement, or what to your mind was another announcement that you were expecting which perhaps you didn't hear?
So, we have been advocating on behalf of the patient. Healthcare costs have to be contained and brought down as much as we can. When the inputs were being given for GST, we as a sector appealed to the government to actually spare the patient from GST tax, which the government did, by the way. But what did not happen was that we have to pay GST on the inputs. So what happens is that the cost goes up because there's a mismatch. We cannot get a set off because we don't charge anything. So that's why we have requested the government that maybe if they were to reduce or eliminate the input tax or GST on inputs, we would be able to pass that on to the patient. So further giving relief in the cost of healthcare. So that's the effort which we are actually now appealing to the government for.
Right, that's a key appeal. Thank you so much for sharing your thoughts and, of course, your big hits and big misses from Budget 2025, in particular for the healthcare sector.
Thank you.
Thank you.